I'm David Goff, Dean of the Colorado School of Public Health, and I'm here with Dr. Amit Khera to talk a little bit about a session we had this morning on the ODYSSEY trials. Amit is a ODYSSEY investigator, and he's going to tell us a little bit about the results that were presented this morning. So, Dr. Khera.
Thank you, David. I'm Amit Khera, Director of Preventive Cardiology at UT Southwestern. We had a fascinating session this morning regarding the ODYSSEY trial. So this is a class of drugs called PCSK9 inhibitors, and this is one specific agent called alirocumab, and we reviewed some of the emerging phase 3 data with this agent. I should say that there are other agents in phase 3. This is not the only one, but we actually got some interesting and important information. So specifically, these drugs have been studied in about 24,000 patients now in the ODYSSEY program. We're looking across the spectrum of endpoints and disease states. So today we heard a little bit about the ODYSSEY combo trial, as well as the ODYSSEY options and ODYSSEY heterozygous FH trial, or high FH. And so what we learned a little bit about was this class of individuals that have heterozygous familial hypercholesterolemia, very high LDL levels with few treatment options, and then adding this agent resulted in significant reduction in LDL levels, with about 50% achieving LDLs less than 100, which was quite hard to do when their starting LDLs were close to 200. We also learned about sort of a real-world issues, which is when someone does not achieve their LDL goals based on old guidelines, LDLs of less than 70 or less than 100, what are the further options beyond that? In the real world, some people will double a statin, move to a more potent statin, or add ezetimibe. And we looked in these studies, comparisons of this new compound with these strategies that people are using, and again, a significant improvement in the proportion of people achieving their LDL goals. And finally, just one last one, looking at people with high LDLs not achieving, again, targets. So we saw 3 studies looking at impressive improvements in LDL and achieving LDL targets across the spectrum of individuals. So maybe, David, you can tell us a little bit about the implications of these studies.
Well, thank you, Amit. I think the other thing that's really very interesting is the safety data. So these studies had participants on alirocumab for about a year. And over that year period of time, no safety signals emerged that would cause any concern about the medication. And this is very good news because these patients have very few options for lowering their LDL cholesterol. We also saw a very interesting pooled analysis of outcomes from the long-term studies. And these were pooled cardiovascular events, and the initial results are quite promising. There was about a 35% reduction in risk for cardiovascular disease across the pooled data. Now, with the sample size so far, that's not a statistically significant result, but it is promising that this new medication may provide benefits for reducing cardiovascular disease and do it safely. So I think for now, we're all very interested in seeing the outcomes of the long-term study that will follow more patients for a longer period of time and provide more information on long-term safety, as well as more information on long-term efficacy for preventing cardiovascular disease. I think what we know today is that this medication lowers LDL very impressively, and it seems to do so safely, at least over the first year, in several thousand patients. We really need to see this ODYSSEY continue and find what the long-term results will be for preventing cardiovascular disease safely.
Yeah, I would just finish by saying, as you said, David, so far so good, and importantly, we're looking across different disease states, seeing consistent reductions in LDLs, and then finally, as we see more outcomes, we'll have to beginning to think about how might this be incorporated into clinical practice if and it does come to a date that they're approved for use.
Yeah, I think the guideline implications may be the final point here. And, the guidelines, Dr. Neil Stone is fond of saying that lower is better with proven therapy. And so I think for now the therapy is not proven to prevent cardiovascular disease, has been shown to reduce LDL cholesterol. It's quite promising and may contribute to guideline updates, but first we need to see the long-term outcome data.
Agreed.
Thank you.